topic today is one that has been carefully selected. We are going to be looking at integrating research in design and measurement of interventions to prevent violence against children. And we are hoping that this is going to be a learning session, as well as a session where we have a lot of reflection to do. So just to say again that you are most welcome. And at IIDC, we are hoping that through this webinar, and probably those that will follow, we are going to have shared learning on how we can actually apply the knowledge that we have and are going to deepen on how to integrate topics on research in our programming work. So just to say, as part of housekeeping, this is a safe space for us to participate, but we need to respect each other's contribution. Kindly do not unmute until it's time given to you by the moderator to speak. And on this call, we are two moderators, myself. My name, Agnes Wasike. I know that many of you know me. I didn't start with the introduction of my name, but that's my name. I'm a technical advisor, knowledge management here at IIDC. And I'll have my colleague, Ronald Senfuka, who will be fully introduced later on when he comes in to facilitate, joining me. And we are going to have you give us some feedback at different levels. We encourage you from the start to first put your name in the chat and the institution that you are affiliated to, and be able to also keep posting your comments and questions as presentations go on. But also later, we shall have opportunity for being able to share your ideas and views verbally. So today's webinar is building on what we started last year. And I will say that we had several webinars last year, around 6, that were largely introducing us the relevancy of evidence generation and use. And we had a number of organizations contextualize this by sharing the experiences on how they are actually trying to generate evidence and use it in their work to prevent violence against children. So this webinar, we are coming to strengthen our knowledge base, particularly on the necessity for research and how to infuse research in programs aimed at preventing violence against children, so that we are able to share together and appreciate why we need evidence building on what works in preventing violence against children in East Africa. Once again, I want to say that this is building on the foundational knowledge we gained last year. And in the same vein, I appreciate the organizations that set this ball rolling last year. We had the Kenyan Medical Research Institute share with us around the topic of evidence generation and use. We had different organizations, Rere Children Africa, Gender and Adolescence Program in Tanzania, and others as displayed on the screen. And we want to say asante sana for starting off this. We are hoping that we are going to continue with the engagements, and more organizations are going to come on board this year to be able to provide a contextual experience on how the knowledge that we are sharing around evidence generation through different methods, including integration of research, are being applied. And today's webinar will have 2 major sessions. We shall start with a session that will feature 2 speakers as presented on the screen. who will be sharing with us from their perspectives and experience on the rationale for research in preventing violence against children programming and the how they have been able to do that. So it's going to be a very rich knowledge sharing experience from Dr. Godfrey Siu, a public health specialist and senior lecturer at Makerere University, Child Health and Development Center, School of Medicine. And the other co-presenter is Mr. Matthew Amolo, who is a technical advisor at the AfriChild Center, Makerere University. So actually today our lead presenters are from Makerere University here in Kampala, Uganda. And the second session that will follow the two presenters will be a session that will be on question and answers. And I'd like to say kindly keep posting your comments and questions in the chat. And the two presenters will be part of the panel that will feature other colleagues from the same institutions. Ms. Claire Bangirana from AfriChild Center will join, as well as Dr. Betty Okot from Child Health and Development Center. Next. And the last session, though not the least, will be a wrap-up. We shall be able to highlight the key issues that are emerging from both the presentations as well as the comments and questions that have arisen. But also we shall have a very brief webinar evaluation. We shall put a link in the chat. And we request that everybody that is on this call kindly give us feedback, as this is going to be very useful in shaping the next learning sessions that we organize around the same subject of generating evidence, but with research integration. So without much ado, I would like to invite our first presenter, Dr. Godfrey Siu, to take on from here and share with us your perspectives on the topic for today. You are welcome, Dr. Siu from Child Health and Development Center, Makerere University. Over to you.
Thank you very much, Agnes. And I just put in my video for a moment so that people can see me. Good morning and good afternoon if you are not within the region. Great pleasure being here this morning. I'm so excited. I've been looking forward to this session from a long time ago. Can you hear me? Just confirm. Agnes, can you hear me?
Yes, please. We can hear you loud and clear, Doctor.
Okay, great. So can I be allowed to share? So you unshare what you have on screen so I can be able to put in my, great.
Yeah,
okay.
You have been granted the sharing powers. Thank you.
Okay, so, this is strange. Okay. Okay. Are you able to see that? Can you see?
Yet.
Not yet.
Okay, fine. Yes, yes. Now we can see. Thank you.
Okay, and just a second, bear with me, colleagues. So I'm now going to disable my camera. I think it might affect bandwidth. Is that okay, Agnes?
I think that's fine. At least I believe everybody has been able to confirm that you are not a robot, you're a human being. So it's well. Thank you.
Thank you. Okay. Great. Let me go back to the presentation. That is the, okay. So Once again, a very, very good morning, good afternoon to all of you. It's really a great pleasure to see you turning up in large numbers. I want to thank you, particularly Agnes and IIDC, for putting together this wonderful webinar and for putting everything together. I know it's difficult to mobilize, so thank you very much. May I just say Happy New Year to everybody. It's the first time we're talking together. I want to thank my colleague Betty, or Dr. Betty Okot, with whom we prepared this and will be joining us during the panel. Special thanks also to you, Matthew, and colleagues from AfriChild for agreeing to be part of the webinar. We've been invited to contribute to this conversation around integrating research in design and measurement of VAC interventions, violence against children interventions. So what we are going to do is to share experiences from the Uganda Parenting for Respectability program. We've been working on a program for so many years now. And from it, we've learned a bit about what it takes to integrate, but also what is the rationale for integrating research in design and measurement. So I hope that by the end of this conversation, we will have created the impression that it is important, it's necessary, and that it is possible, and then this is how to do it. I don't want to assume that this 30 minutes or 20 is enough to even cover the entire area. This is a very broad area, and it's just about beginning a conversation. So colleagues, if your interests and expectations are not met, it might not be because we didn't we didn't prepare well enough, but maybe because the session is not sufficient to cover everything. So today is really special because all of us who are in the area of violence prevention know that research and data on violence against children is scarce, but most importantly, it is inconsistent, particularly in this area, in this setting, East Africa. So as a result, we often don't have sufficient evidence on the nature and impact of our interventions on preventing norms that perpetuate violence and improving parenting skills and so on. So I hope that in this conversation, we shall raise some critical considerations and share experiences. And that will be followed with a discussion, and I really look forward to that session. So this is the two of us. You've seen me at least, but that is Dr. Betty Okot, my colleague at Makerere University Child Health and Development Center. Allow me to introduce the department for which we work. We are members of the Child Health and Development Center, which is a teaching and research department in the College of Health Sciences, School of Medicine, Makerere University. We currently have several research programs. In addition to our teaching mandate, we have several research programs. And one of them is called the Families, Parenting and Children's Health Program. Under this program, we've been growing quite significantly in the past few years. We do work in the area of parenting, in family strengthening, violence prevention, improving child well-being more generally, through about 5 projects, active projects right now within one program. So the Parenting for Respectability is our choice. We are going to be talking about it and how we integrated research. But you might also want to know, for those who are based in Uganda, we have what is called the Parenting Agenda Initiative, which is a collaboration with the Ministry of Gender. We also have the Global Parenting Initiative, which is an
Excuse me, doctor.
Yes, please.
Kindly put in presentation mode, and then we are not able to see the slides. We have not even seen Betty properly yet. Thank you.
I thought you had already seen the presentation.
The presentation is on the screen, but the slides are not moving. They need to be in presentation mode.
They are. So this is the challenge now. Okay, let me try again. Please bear with me one more time. And I am going to do that again. And Has it come? Have you seen it? Hello? Can anyone see the slides?
Yes, please. We are
Are
now
they
seeing the
moving?
slides.
Are they
We are now
moving?
CHDC. What does CHDC do? Thank you.
Yes, yeah. So I had already explained this particular slide, and let me just move forward because time is. So I think, Agnes, you did give a preamble to this, but I want to build this up a little bit more to provide context. That there is often evaluation, what we can call evaluation anxiety. So when we begin to develop programs to address violence against children, one of the questions is always around evaluation. But we are all very quick most times to dismiss it, or even very reluctant to integrate research in design and measurement of parenting programs or other violence prevention programs. So what we see is that people working in violence prevention often find it difficult to understand the importance of carrying out evaluations or research. And there are several reasons for this. Some of them are quite plausible reasons. I'll list a few. One of the reasons for the reluctance or the anxiety that we see that leads to reluctance to integrate research is mostly because we do not have funds to carry out evaluations. Some people find evaluations quite expensive, and indeed they are. And many times say, no, we can't do that because we don't have money. The other reason is lack of skills. And this is a common problem because many of us are not trained in this area. We are program officers, and then we are told, can you do an evaluation? Where do you get the skills from? We also are afraid of getting negative results. Quite often, I think the issue is the issue is that we have been given a funding on the promise that we are going to change the situation, we are going to impact, we are going to, and we must actually state our impact in a positive way so that we can promise whoever is funding us. Now, sometimes the results are negative, and program people are quite frustrated that they fear. But I would like to tell you today that I think funders have begun to appreciate that even negative results are important as long as they have been arrived at from a systematic process. And many times we also don't have time to carry out an evaluation. Or most importantly, most people come to program design with the view that they already have a sense of what is working. I said, but people like the program and we know it's working. And so what is the deal about measurement or carrying out research? But investing in research during design of VAC interventions is critical if we want to know what is working and what does not work. Specifically, we invest in research to make things better. And far from it, we are not aiming to make things worse. Investing in research can actually save money. It doesn't waste it. Above all, I think we are going to make a big prevention mistake by throwing money in an intervention that is without evidence. So it's some kind of a discussion that can go beyond the sector we are in. In public health, is very well known that if you don't invest in research, you're not going to have generate evidence-based practices and recommendations. And so you could easily drown with your research. So on that basis, how does research help in intervention design and measurement? We all know, and perhaps some of you are much more familiar with the main goal of research in violence prevention work as being able to estimate whether the program is causing change. We want to show evidence, we want to show impact. So we are concerned with three main things here. We want to know whether there are changes in the program, in the community, in the population of interest. And two, whether it is the program and not something else that's causing these changes. And also want to know how big are these changes. So that calls for outcome measurement. That calls for research to measure outcomes. But we know that program design research can also answer other key questions. For instance, how acceptable is the intervention? How is implementation being done? What's working and what's not working? And what are the facilitators and barriers for success? So we can actually do research to address outcomes as well as process. And so these are the two common dimensions of research in measuring interventions. One is outcome research, which is often referred to as impact evaluation, sometimes called effectiveness studies, to examine the effect of the intervention on populations at different levels of prevention. But we can also undertake more complex research, which is about the process. And this actually is focused on the way the program is being executed rather than the outcomes. We are all familiar about the tension between monitoring and evaluation research. Sometimes people say, but we have a very clear monitoring framework, and so that's going to help us to do research. But I want to just make a distinction, a brief one, that monitoring is different from impact evaluation. Impact evaluation, as we can see, assesses the impact to determine what the intervention is doing. And it is quite separate, different from monitoring and evaluation. So if we are conducting research within program design and measurement, there are at least 4 main kinds of research that you can engage in. And we can look at this research happening at different stages of intervention development. First of all, at the development, 2 at piloting, and then we conduct evaluation. And finally, when we roll out the intervention, we look at implementation and how that is happening. To present this in a more systematic way, you could, oh, I'm told the slides aren't moving. There must be some problem. Agnes, I'm very sorry about this. Can I maybe unshare and we go back to the original plan that you share from your side?
Okay, please, let's do that.
Sorry, I should have been told about this long time ago. I'm really sorry. Don't know what's happening here. Okay.
Just, yeah, let's do that.
Okay. So could you help me to share? All right, so you move until, can you move forward? Carry on, please. I'll tell you to stop. Next, and next. So continue. Okay, so this is, sorry, there. So, oh, now this is also where is a problem. Go back. One more slide. Okay. Is
that fine?
Yes, so I just wanted to present the previous slide in another way to say that intervention research can take the form of formative evaluation, process evaluation. Can you move forward? Implementation evaluation, impact evaluation, and cost effectiveness evaluation. So these are the different dimensions of kinds of research that we can do in intervention design, development, and measurement. Let's move on. So many times we are concerned about evidence, and I like your emphasis on evidence generation, Agnes. So it's important that how we ask the question, how can we show that our program is effective? If the primary goal of research in program design is outcome evaluation. Now, the quality of evidence of intervention effectiveness basically depends on the type of evaluation carried out. I'm sorry, this is a very small diagram, but many of you, some of you might be familiar with what is called the hierarchy of evidence. Researchers have come to a conclusion that when you conduct research using different methodologies, you generate different kinds of evidence, and that will tell you whether the intervention is effective or not. At the very bottom is usually what we have, what's common, which is expert opinion. Program implementers, they work in the field every day and they see and witness some people changing, and they will tell you, wow, people are changing. Sometimes we do literature reviews and surveys before interventions begin, and we say, so we have information. But as you move above that diagram, that triangle, you get to a level where you are talking about randomized controlled trials, RCTs. RCTs are the gold standard in intervention design and measurement, because they provide you an opportunity to collect data through a comparison of different populations, one population receiving the intervention and another not receiving an intervention or receiving a smaller dose, and then you compare to check whether the impact is there. And maybe we shall look at this later. So let's move on. We're thinking about time. So in intervention measurement and design, it's important to always think about tools and measures. This is an area, Agnes, again, that I think will need its own time. But there's a problem that sometimes we use tools that are generated from the team, or tools that have been recommended by a funder, or tools that nobody can explain their origin. However, the global community has come to a conclusion that there are some tools, some measures that have been validated, and these tools are often the ones recommended if you are to generate evidence that can be considered, that can be appreciated and considered standard. So I just wanted you to see this slide and see that you can find questionnaires or questions from different interventions, different programs that have been validated, and they can work for you. I'll be back with this in the discussion later. Can we move forward? Can we move? So, having given that background, I now want to take you through how we developed the parenting for respectability, how we designed it and incorporated the principles that I've just gone through. The Parenting for Respectability is a Ugandan evidence-based parenting program that targets both male and female parents. It's a 16-session program, and it is delivered by community facilitators or community volunteers. The program is rooted in rigorous research, and we've gone through at least 5 stages of intervention design and research. I'm going to move to the next slide to begin to consider these different phases. So phase 1 of our work was to come up with tools. We developed tools. So we did a study that was titled Measuring Parenting, and this is a tools development study. The aim was to develop a culturally sensitive tool for measuring parenting in low-income countries. So what we did was to explore existing tools. We found that most of them had developed from high-income countries. They measure some common variables with us, but there were dimensions that we were not sure of. So what we did is to develop tools based on both EMIC and ETIC. And EMIC and ETIC, what's going on now? All right, good. So we drafted questionnaires combining our ETIC, the materials from WHO tools, and our EMIC, okay, the local perspectives. So we went to the community and asked them, how would you measure parenting? And they said the concept of respectability, collective parenting are really important. these measures were missing in the WHO schema. So what we did was we were interested in the feasibility of that tool. And so we administered it to different parents and then went on to revise and then piloted it. So we went through different iterations. At the end, we did at least 4 rounds of data collection using that tool to test whether this tool works. And can you go to the next stage? So the outcome of the tools was that it was feasible to develop a culturally sensitive data collection tool that was rich in different dimensions. And we included questions about fathers and mothers in the same tool. In many tools that are existing, they ask only one parent about their caregiving and their relationship with the children. But in the tool we developed, we found that it was necessary to ask a parent about their own caregiving and the caregiving of their partner. So let's move on to the next stage. So in stage 2, we now began to develop the Parenting for Respectability program or project. And the aim was also to develop an intervention that is culturally sensitive. So initially we developed 21 sessions and we had an advisory committee and we relied on expert knowledge and professionals and came up with 21 sessions, but we had many questions. For example, what are parents' views of program relevance? How suitable is this program? How will recruitment be done? What is retention like? And is it feasible for local facilitators to do this? So our aim was not, at that point, was not to impact the field of violence. It was not to reduce violence against children, but to develop the intervention that is acceptable. So the results was that from 21 sessions, the parent found it too long and they recommended a reduction to 16 sessions. So you can see the value of research. Next. So what resulted from this is a manual that was now reduced. We also came up with the attendance register based on recommendations by facilitators. We came up with different tools. But most importantly, we managed to publish 2 papers. One is the design of a Uganda parenting program, a description and formative evaluation. That paper is becoming so influential and it's so informative. We also published a paper on men's involvement in a parenting program. These were all questions we wanted to address in the initial design of the program. Go to next slide, please. In phase 3, we conducted a large-scale pilot before and after outcome evaluation with 600 parents, and we interviewed parents and children using a questionnaire, and the aim was to check whether the program has preliminary evidence of effectiveness before we launch into a large-scale randomized control trial. So we wanted to check the relevance of the measures that we had already come up with, and we assessed the program. What resulted was that we found that was feasible and that Parenting for Respectability could actually improve IPV and VaC. But we were not satisfied because we knew that the design we had gone with was not the most rigorous. So we wanted to do a randomized control trial, and that is what happened in stage 4. Can we go to stage 4? Next. Oh, sorry. So we managed to come up with a few publications. Actually, this paper is being accepted now. The impact of Parenting for Respectability on reducing violence, on violent parenting and intimate partner violence in Uganda, a pre-post study. We also wrote up a paper on motivations and challenges of local facilitators in implementing a parenting program. All this is because we had a research lens. Okay, could we move next? In stage 4, of the design and measurement of the parenting for respectability, we are now convinced that at least there is evidence that it might be an effective program. So we wanted to confirm the impact of the parenting for respectability. So we designed a hybrid type 2 randomized control trial, which combined implementation science with 2,000 and about 2,300 parents participated. And I just wanted to show the results here, but I think I'm really sorry the slides don't show what I wanted to show. But just move next and I show you what has come up from this. The publications or the research output is that we have submitted these to different conferences, and we are looking at various things, including predictors of attendance, impact, and so on. And another publication that has resulted is the case for assessing and reporting facilitator fidelity. And we argued for implementation of facilitator fidelity assessments in parenting programs. Can we move? And finally, we are now at the stage of scaled implementation because we know that PFR, parenting for respectability, is effective. And so we are trying to determine what happens on a large scale if you roll out the program. Are intervention components still going to be delivered in the same way as the original design? What modifications are happening and to what effect? And so we have a wide-scale implementation currently going on, and we are actually doing what we are doing different kinds of design, but the most important one is the re-aim framework, which enables us to assess the extent of the reach, the effectiveness, but also assess adaptation and implementation realities on the ground, including integration of the intervention into the national delivery systems. Next slide, please. So institutionalization of the parenting for respectability is an important concern. And one of the things, some of the things we are addressing include strong leadership and governance, engagement and local support using both state and non-state actors. And so we have, through the National Parenting Agenda Initiative, been able to support and will continue to support the institutionalization framework, and I think that will be another discussion altogether. And next, I'm about to finish. I'm just almost done.
Yeah, you have 1 minute left.
Oh,
thank you.
So, because since we started PFR, we have been delivering it using in-person delivery. So facilitators gather together parents and deliver the intervention to them. But sometimes this results into suboptimal delivery. So we are now moving to digital delivery of the Parenting for Respectability program. And in the next slide, I'll be telling you what is happening. Please just move to the next slide. So we have conducted workshops to design the Parenting for Respectability app, and we had a 5-day workshop that was conducted by experts, and we learned the design, how to transform a manual into a digital version, creating content and being able to create an app. Next. So this is the prototype, and this is how the app looks like. And very soon we are going to pilot this app and generate further evidence. As you can see, the first is welcome to Parenting for Respectability, and then you go to the different modules, and these are the instructions on how to participate. Next, please, as we finish. In the workshop that we conducted, we took a research lens again, and we just wanted to know how are the workshop participants appreciating this workshop. And we found that there was greater efficiency. People said now the quality of our work is going to improve. People thought that the workshop was enriching and that they had learned to connect with others in the same field. I think I will now say the final slide. Let me move to the final slide. That is the final slide. All this comes to this conclusion that evidence-based generation is an ongoing process. It must start from formative work to all stages of intervention design, implementation, and scale up. We need to develop a culture of evidence-based evaluation. Finally, by collecting systematic data on the process, implementation, outcomes, and impact, we don't only measure the impact of VaC programs, but we can also share lessons with stakeholders, and we will be able to contribute to the much needed evidence on the impact of VaC interventions. Thank you very much for your attention. Sorry for taking longer. I acknowledge all these collaborators who have been very significant in this work. Thank you.
Wow.
And to you.
Thank you so much, Dr. Godfrey. See you for a job well done. I believe you've done justice to the topic from your perspective, because not only have you shared the theory and what comes with integrating research into programs that are intended to prevent violence against children, but you have showed us a practical example of how, in a phased manner, you have been able to apply research that has brought a lot of value addition in terms of knowing what is working and not, being able to develop culturally sensitive tools and manuals, but also contributing to the knowledge base. I know that we have limited evidence shared from the Global South, but we are happy that Parenting for Respectability has already been flagged into journals that are able to be read by people far and wide. And this is a great contribution. Thank you very much. I would like now to invite our second presenter, and that is Mr. Matthew Amolo, who is a technical advisor at the AfriChild Center, Makerere University. I'm glad to say that today we are actually benefiting from both presenters are coming with a health background. He's a health research and evaluation specialist. You are most welcome, Mr. Matthew Amolo, to proceed. Thank you.
Thank you, Agnes. Just to confirm, Agnes, okay, thank you. Thank you. I didn't want to get into the stress of the network. So again, thank you so much. I want to first of all recognize IRDC for this opportunity that you've granted unto us to be able to share the work that we are doing, but most importantly also continue to draw learnings from what each one is doing. Dr. Siu, thank you for doing justice through the initial presentation. And Dr. Betty Okot, I'm very glad that you're here as well, and for the contributions in the earlier presentation. So this really makes my work really very easy for me to make people a bit dirty. We are going to get into the mud in a few slides, but I'm sure, as Dr. Siu indicated, we still continue to collaborate. Even within the 20 minutes, we should be able to learn one thing or two. So just briefly to start us off is to talk about AfriChild. I know I didn't indicate in the slides who AfriChild is, but it would be unfair to the institution that I represent if I didn't say something or two about them. So the AfriChild Center is based in Makerere University at the College of Humanities, and it was established in Africa, really to address the research concerns for issues that affect children in the African region. In terms of the vision of the AfriChild strives, for an Africa where children's well-being is realized for sustainable development. And in doing so, the AfriChild generates research that contributes to the evidence base to improve really lives and well-being of the African child. We work with in collaboration with public entities, the universities within the global south, but also the global north. We work with the private sector and practitioner organization, like most of you here. Our key priority areas include child survival and health, development and education, childcare and protection, and then last but not least is the child participation. And the issue that we are talking about today, VAC prevention programming, really cuts across the priority areas of the AfriChild Center. So when we had the initial discussion, I said, Agnes, I need to be able to speak to the people who are coming to this webinar. So she informed me that our group is largely comprised of practitioners in VAC prevention and response, or also advocacy, researchers from different fields, policymakers, partners who have, VAC prevention programs in Africa, UN agencies, and largely most of these come from the East African region. So next slide, please. So in terms of really contextualizing the issue that I want to speak to, which Dr. Stu did a good job in giving this background, I wanted to highlight these 4 key issues that we may choose to agree debatably that there are many actors and programs within the Eastern Central Africa that are implementing something or some interventions to address violence against children. The other issue, though, is that research and learning is often seen, or not seen, but even in practice, is an afterthought. And therefore, creating missed opportunities for us to be able to, generate learning and improve the kind of interventions that we are doing. So, and this is not really deliberate in most of the instances, but it's because of the gaps that exist in research, the evaluation, and learning. There are gaps there, even when they generate research. The ability to be able to translate this research into small pieces that can be utilized by the different actors is also limited. And this, therefore, calls us to be able to design but also implement interventions with our end in mind. This is very critical, that from the design phases, as we are planning, we should be having what is that outcome that our VAC prevention programs are aiming to address. And ultimately, we are all making a contribution, whether at a local level or national level, or at a regional level. Next slide, please. So I find this as a very important slide in setting us off. The case for evidence, the research evidence. Dr. Stu talked already about the typology of evaluations, which I'm not getting into. We will talk about the designs later, but it's important for us to start from the basics. That if we appreciate research as something that is a systematic inquiry, and that ultimately should lead to acquisition of new knowledge, then therefore the evidence from research should be that evidence which we are able to verify scientifically. If we have a claim that something is working or not working, then others should be able to claim, to test it, to test your claim that actually this works or this does not work. And that applies as well to the processes. If you are actually conducting an evaluation on a process, then scientifically we should be able to prove that this particular approach works better than this other approach in these different circumstances. So therefore then, why is it important for us to integrate research in VAC prevention programming? The issues of demand for impact is very important. Even without anybody breathing on your neck, we should be able to say, okay, this is the change that we have created. That is very important. When we're talking about evaluations, impact is very important. And just maybe to take maybe a few seconds on impact, because we want to see improvements in the communities that we serve, then scientifically we need to prove that this is where the communities were before we started engaging with them, and this is where they are. And there are different ways you can prove that. You can also say, okay, in terms of the interventions we are doing, scientifically, these interventions actually resonate with the needs of the communities, with the demands of the people. And that resonance or relevance of interventions can only be proven scientifically, not emotionally, because we get carried away because of our passion for communities that we serve. And you say, this is what they deserve. But have you done a systematic inquiry of assessing their needs, either informed by them or informed by a scientific review of the needs? And then we also get into the issues of accountability. As practitioners, we need to be accountable to ourselves, accountable to the beneficiaries, the communities, the governments that we represent, because ultimately the communities are part of a certain authority. So we need to be accountable to the governments as well, and the different entities and funders that we serve. So this is very important to set us off to talking about the evidence and how we integrate it in our programming. Next slide, please. So I created this visual just to remind us, this is not a new slide. I just customized it. This is the basic typology or the basic structure of a typical project, that you will have it start, and then you have the planning and design phase, implementation and termination. Those are the four the main sections. Others will tell you there are 6, but these are the main ones. So when we are talking about research and learning, we need to identify opportunities for us to do research and learning. I have used the black arrows to point to areas where we can actually conduct some research, learning, or even research and learning together. So between the project start and planning, you need to be able to conduct a certain study there to inform your planning. What is your planning based on? What evidence are you basing on? Are you doing a study? Are you doing something exploratory if you don't have evidence? And say, based on our exploratory study, this is what we have, and this is informing the design. Between the design and implementation, are you doing, for example, a pilot to inform your implementation process? Between the implementation and termination, are you doing something, maybe a process evaluation, to inform what you're doing during that process. And similarly, after termination, are you also doing something to, for example, to assess what impacts you have created in the communities after you have left? And this is a challenge for most of us programmers, because of the funding cycles. Once we do the end-line evaluation, we leave the communities to whom it may concern. But as a scholar of evaluation, we need to be able to track what are the long-term effects or changes that our projects have created. But also there is learning that can occur within the 4 phases. Within the project start, you can also do some learning in there. You can also have some learning during the planning and design, and similarly to the other phases. Next. Thank you. So briefly, the approaches, the broader approaches to evaluation research, you'd have your quantitative, which is interested in count data. Then you have the qualitative approach, which is really focusing on the narratives. And then the mixed methods approach that focuses on both the qualitative and quantitative. So you are able to have the magnitude, but also explanations to whatever you are seeing represented in figures. Next. So yes, Dr. Su already told you about the different types of evaluations. That's very great. So my work is easy here to talk about the designs. And this is important because as programmers, we need to have this information. That because we are talking about evaluations, how then should we be able to design them? What are the basic namings and structures that these designs can take? Okay, so because we are interested in most of the times comparisons with this group and the other group, we have 3 broader designs. We have what we call the comparative group design. Then we have the experimental design, and then the last one is the case design. So I'll start in a few, maybe 1 minute, just run through this. The most common one is the naive design. And this is the one that most evaluations take in the Global South. So you are having your 2 groups. They are not randomized, but you are having 1 intervention and 1 control group. And what you're trying to say, because of your interventions, you're seeing some change in one group, and therefore then you attribute that change to your intervention. We call it naive because the change could have been created by any other factors which are not really related to your intervention. But also we have what we call the basic value added design. And for this design, we are saying that at the start, we measure the differences in groups such that when we are assessing change, we account for that difference. But also there are these other 2 designs that focus on largely models, mathematical models, the regression adjusted covariate. This one largely uses regression methods. And we are saying that we want to assess your exposure and the outcome when we can account for the different other factors that might have contributed to the change. Okay. Sometimes also, if we are following groups, we can have what we call interrupted time series. So we are able to compare them over different time points. So the designs could take those shapes. Next one. Next. Yes. So the experimental designs where we have the randomized control trial, already the previous presenter talked about it being the gold standard in evaluation research. And then we also have the non-randomized control trials, or sometimes we call them the quasi-experimental. And here we have the regression discontinuity design. We also have the matched design. But the last one, which I would want to bring attention to, is the case study design. This is very important design because the next slide, because the case study design enables you to be able to, sorry, previous one, the case study design helps you to be able to gain in-depth understanding of your problem, but using a smaller group or a smaller sample. Take, for example, when you are starting your project, you may want to understand a problem in a certain community of either people or even an ecological zone. So you go there with an exploratory mind. Also, sometimes during the implementation of your project, there might be populations that are giving you something which is unique in terms of outcomes. So therefore, you say, I want to understand this phenomenon in a deeper with a deeper perspective. So you get in there and understand these issues. Next. Yes, so I gave you that perspective such that it will be easier for us to talk about what we are doing with the Good School toolkit for secondary school. And this is an intervention that has a research component. Largely, we get, when we are discussing as a team, we wonder whether it is a research project or it is an implementation project with research. But it's a project that is being implemented by Raising Voices, London School of Hygiene, and AfriChild Center. The Good School Toolkit is designed by Raising Voices, a local NGO in Uganda, and they implemented this toolkit already in the primary schools, and it was found to be effective in reducing violence by 42% in the intervention schools. And so they, as part of the engagement efforts with different stakeholders, including the Ministry of Education and Sports, there were calls to try this also in secondary schools. And so we started a process of trying to implement this in secondary schools. So currently, the GSTS is being implemented in 8 secondary schools in Kampala and Wakiso, with the aims of, one, refining and finalizing this intervention, also to understand whether it will be feasible to deliver it at a larger scale. And if we are going to a phase 3 trial, what are the parameters in terms of the sample size and measurements that we need to account for? Just to highlight that this is a phase 2B trial. So it's really a pilot trial. Next. Yes, so I summarized the processes in these in the schema. That the Good School Toolkit actually has been implemented. The pilot trial for secondary schools has been implemented so far in these 6 different phases. And the first phase, which we call the adaptation phase, involved, identification of newer content that could be seen to be relevant for secondary schools. For example, if you talk about issues of gender awareness, if you talk about issues of mental health, those might be issues that are critical, issues of participation in schools. So those different packages, including a systematic process of understanding what the secondary context is and how that might actually shape the implementation of the Good School Toolkit in secondary schools. So that process was undertaken in 2 schools in Kampala and Kampala and Wakiso, and that shaped now gave us what we call the crude the crude toolkit that would then proceed to pilot in secondary schools. However, we had to also do cognitive interviewing as part of our efforts to refine the measurements. Because as you are aware, and then the previous speaker said this, some of the measurements that we have are already developed. However, they have not been tried in the global south. For example, if you talk about the school climate measure, the beyond blue school climate measure, which really talks about connectedness of children to their school, connected of children to their homes. How do they feel about their school? If you're talking about the strength and difficulty questionnaire, which Dr. Kresu as well also mentioned, has this been cognitively tested in Uganda? Have you tested it in secondary schools? So we did that process also in 2 schools, and we were able to do what we call iterations. We're able to do some 4 cycles of learning and improvement of how we ask these questions. So after that, then we're able to conduct a quantitative baseline for the GSTS, and we had 8 schools equally distributed. That's what we're calling a 1-by-1 ratio. And this was conducted in 1,100 participants, 200 teachers, and 960 students. After that, then the intervention processes started in half of the school, because it's a pilot. We're not sure that this thing works. So we wanted to try in 4 schools. If the results show that it works, then we are able to roll this to the other 4 schools and think of a bigger trial. The part of the refinement of the intervention.
We have 2 minutes left. Thank you.
That's okay. Thank you. So part of the refinement of the intervention involved the process evaluation. So we're able to conduct qualitative interviews, 4 rounds of or 4 time points, qualitative interviews, and understand some of the issues that needed explanation. And at the end of it, in 2023, we're able to conduct our end-line evaluation. Next. So what do I see as my key take-homes? That research and learning are integral in our current VaC prevention programming, that learning occurs at all and within the stages of the project. As programmers, we need to identify the end at the start of the project, develop and visualize the mechanisms through which we shall be able to reach the end. And then also we need to document how we'll scientifically measure attainment of our project outcomes. And lastly, next slide. As program people, as researchers, let's always focus on generating this rigorous evidence. Let's not tire to share the evidence and integrate learning as part of our different processes. I want to thank you for the time. Thank you, IIDC, for the opportunity. I have left some reading materials there, which I'm also going to share with Agnes. Thank you, Agnes. Over to you.
Wow. Thank you. Thank you, Matthew. This is phenomenal. Thank you very much. You bring new insights in addition to what the first speaker presented. You clearly emphasize the rationale. We cannot work without showing what change is happening, what kind of impact are we able to harness from our interventions. And this is good for accountability to government, to donors, to whoever is investing in the work we are doing. But you also clearly, in a simple way, showed us opportunities for research and learning within the project cycle of preventing violence against children. I believe if anybody has forgotten anything, at least one should remember that at different stages, you can do at the start an exploratory study, you can do a pilot study, you can do a process evaluation along the way, but also end-line evaluation. I'm really grateful that you came on board and contextualized with an example of the pilot study that is being done by Raising Voices with the Africa Child Center support as they scale the Good Schools Toolkit from primary schools to secondary school. One would ask, but why pilot again when you had already done it at primary school for many, many years, over a decade? But I'm happy that you brought this to the fore. So I would like at this moment to invite us to the next session where we expect that there are questions already in the chat. And I'd like to invite my colleague who is going to moderate this session to take over. Ronald Semfuka, Technical Advisor, Monitoring, Evaluation and Learning here at IIDC. He's right here with me to take us to the next stage. Thank you. Welcome, Ronald.
Thank you, Agnes. And thank you so much, Dr. Sue and Matthew, for that great presentation. For sure, I want to say that a lot has been shared, given the limited time that we had. And of course, I would want also to greet all that are within this call, the participants. Thank you so much for participating. A lot has been said during the presentations. And of course, when you look at the topic of today, which is a very critical and important within our organizations in terms of ensuring that we implement projects that actually are impactful, and at the end of the day, they are able to be scaled beyond our own countries, even to other countries. So I think this process of engagement and the information being provided is really very critical for whoever has participated here. And we believe it has really sunk into our minds, and we are able to at least pick one or two things that can support us when we go back into organizations. At this moment, I want to introduce myself. I'm called Ronald Semfuka. I work with IIDC, and basically my role is I technically advise on monitoring and evaluation. So basically this entire webinar has been speaking to part of my docket of work. And I feel very excited. And actually, what has been spoken is what we always talk with our partners to ensure that that is the way to go. If we are to ensure that our programs are more evidence-based and they are scalable beyond our own location that we are implementing our projects. I want to introduce the next session, and this is basically going to be around having some kind of reflection. I know from the chat room, I've been able to capture a few of the comments from the participants. And I think I will start from that, and let alone in the case of any additions from the participants, we shall give an opportunity for them to raise their hands. And we pick those few reflections that can actually enrich this entire discussion. So from the panelists, I think already we had Matthew and Dr. Sue introducing themselves. I would want also to say that we are adding two of the panelists for you to know. Kelea Bagilana, who is the Director of Research and Knowledge Management, Africa Center, University Makerere, and then Betty Okot, Child Health and Development Center. So these are joining us at this stage of reflection, just to bring in our experiences and the experiences to see how best we can really better ensuring that there is that ongoing integration of research, measurement, and learning into our ongoing projects. So quickly, I think I will start from a few of the questions I captured from the chat. And one of it goes to Dr. Sue. One of the participants has requested and said that would it be possible to have that research paper that has been done in Uganda to be either considered as a paper to recite, to cite and use outside Uganda, particularly in Tanzania, as part of a reference document. And then The second question was that I think the participants are really interested to be able to access the paper that you presented, which actually has evidence on your program, which would be very relevant for reference in terms of reading and enriching themselves. And then lastly, another question was around the app. I think through your discussion, you talked about of the app, which has been used under the parenting program. So one of the participants would want to know if such kind of application can be able to be used even beyond where you're using it as part of having an effective delivery of their program. So I think we can start from that and then as we proceed. Thank you so much. Over to you, Doctor.
Excellent. Thank you so much for the comments and the question. I'm here with Dr. Betty Okot. I think you should really invite Betty to respond to most of this, because I think I've talked sufficiently. But can the papers be shared? Yes, definitely, yes. Some papers already accessible on the internet free of cost. So you can download, if you say paper engaging men in a parenting program, then you type my name or Uganda, it's likely to come up. The other paper that is available online is the design of the Uganda Parenting for Respectability Program formative evaluation. And that paper is really good because it describes the whole process of development of an intervention. It goes beyond PFR to identify some very important principles in intervention design. So thank you. And Betty, is it okay if you can answer the question of whether the app is transferable from Uganda to, say, another setting? What kind of adjustments or modifications will need to be done? What research should happen? Over to you, Betty.
Thank you. Hello, everyone. I hope you can hear me.
Yes.
Great.
Yeah,
thank you. Thank you for inviting me, Dr. Siu, and thank you, IIDC, for holding this webinar. At the moment, what I can say is that the app is at the prototype stage, where we are finalizing and finishing up with the development. And the anticipation we have is that once the app is ready and usable, it's going to be uploaded on Google Play Store, so that any parent interested in learning or engaging with the Parenting for Respectability app and information can actually download it. But at the development stage, we are going to restrict the app to a group of parents that we are going to be trying the process with, to test if this app actually works in promoting the parental respectability concept, if it is useful in our violence prevention research. We are going to test its functionality, understand if the features work, and for what type of parents is this going to work. So in the meantime, in the process of the development, we are going to be working with very specific parents. We are going to identify parents from what we call the resource poor context, people who might find it difficult to access mobile applications, may not have access to smartphones, and may find it difficult to even buy and upload data. And then we are going to compare with parents who have easy access to these resources and find out which type of parents are finding this more useful and how they're working with this. So in the study process, we will then come up with a clear understanding where this application is going to work. Again, we are benchmarking our work, paying attention to what Dr. Siu earlier on said about research process and how it contributes to project development. We are benchmarking our development process on similar apps that have been tested and used in other countries in sub-Saharan Africa. For instance, the parent app in the parent app for teens, I think, in South Africa. We are taking a lot of insights and learning from them. And also there's a study that has been done in Tanzania by some of our collaborators using similar applications. So it is still a learning process, but at the end of it, we want to open it up to parents. Thank you so much. Everywhere.
Thank you, Joyce, and thank you for referring to the Tanzania work. Dr. Joyce Wamoi and colleagues pioneering work in development of parent app, and it's really wonderful. So colleagues from Tanzania and other areas, you could check out Dr. Joyce Wamoi's work.
Yes, thank you.
Thank you so much. Yeah, so I think at this moment, I would want to also share some of the reflections that have been, shared for Matthew. One of the participants has provided this kind of reflection that looking at the project cycle, what is commonly done is the baseline study between the project start and implementation. Now, during implementation, normally what is carried out is ongoing monitoring and learning. Then an end line, which is at the terminal stage of the project. So for him or her, they're asking that could this be translated as research and learning as part of today's theme that we have been able to discuss. Over to you, Matthew.
David, this is a very good reflection. I see and that one of the part of the reflection that I also have been having in this evaluation field is that the nomenclature of our processes. We started with monitoring and evaluation. Then we went to monitoring, evaluation, and learning. Then we went to monitoring, evaluation, and accountability and learning. Then we are advocating now for monitoring, evaluation, research, and learning. Yeah, so I agree with the submission that loosely you can actually call it research and learning, because in the broader spectrum of research is where you have the evaluative research, and in that umbrella, the process evaluation, where you have the monitoring for outcomes, really, if you're more focused on looking at outcomes and less of the processes. So the issue that we need to continue to reflect on in all these different things is at what points are we able to leverage for us to do learning within the project cycle. And that's why I was happy when this participant was pointing out that, we usually do a baseline and then we do monitoring. And we said that we need to, at all stages, even just at the start, before you conduct the baseline, could you do an exploratory study with a few participants just to understand what is out there before you go to your predefined communities to do a baseline? So the bottom line is, let's continue to identify opportunities to learn. The learning is not only restricted to research. The learning can actually happen in the processes. And I think Dr. Siu mentioned this in his presentation as well. So we need to be able to pitch the learning, but also the research, but also identify that sometimes learning happens outside the research, and the evaluation field has the different learning approaches which we can systematically document, and then that should be able to guide our processes. And if need be, then you can say, okay, can we interrogate these in a systematic way or in a research perspective? But thank you, David, for pulling that reflection.
Can I just add something quickly?
Yes,
please.
Thank you very much for that response, Matthew. So really good. So just to add that baseline, M&E in the middle, and end line addresses just one particular question in evaluation design, intervention design, and measurement. So what kind of question are you addressing? If you have a question around what is the impact, what is the outcome, so the end in mind, you want to change this the situation, then you're likely to be focused on baseline. What is the situation before we start? So you want to measure what's the prevalence of violence against children. Say, it's 50%. And then at the end, after you've done the intervention, you'd like to say, has my intervention reduced violence? Then you do end line. So that's impact evaluation or outcome evaluation. But we say that evaluation design of interventions must be also assessed using other methods and to address other questions. For example, is the intervention acceptable in the first place? Before you even start delivering it, do participants engage with it? How is it? How are they engaging with it? What are the things that they think about? So if the intervention is new to the participants, or it is something developed and tested in another setting, you might want to do some adaptations. How do you adapt? The questions that you address within there will require you to do other form of research, which is not just baseline, M&E, and N-line. You need to do process, you need to do formative research, because when you're creating a program, as an expert, you think this is, I need a program of 10 sessions, but then the participants may not have time to engage with 10 sessions. They might just want 5 sessions. So you need to test that before you roll it out. And those are the opportunities I think that Matthew has been talking about. Thank you.
Thank you so much, Matthew and Dr. Su. I think there is a participant who has some feedback reflection here. I think it goes back to Dr. Su, and it says that, could you speak a little bit on the name parenting for respectability? I'm interested because in this, you mentioned that parents indicated that respectability is important to them. What does respectability mean, and why is it important to them? Also, they are saying that they could do, if you could share the link to the articles that you shared during your presentation, it would be great for them. Thank you. Over to you.
Thanks very much. I don't know whether Betty, you are available to speak on this, on respectability and how it becomes part of the name for the program. Betty, is that okay? Hello, Dr. Betty.
Yes, Doctor. I would have left that with you, but the program, as Dr. Siu earlier intimated, responds to the parents' motivation for raising children that are going to be respectable and respectful. These motivations actually arise from the context in which we, as I would say, individuals, communities, or societies are raised, how we have been socialized. In the African context, most parents are motivated with the idea of, my child has got to be someone like this and that, most times a role model in society, somebody exemplary. And this determines how parents practice their child upbringing, how parents raise their children. But in the process of that, a lot of times, children experience violence. This happens in situations where we conflate disciplining with parenting. I mean, we conflate disciplining with violence. Instead of talking to a child about his conduct and behavior in a certain manner, a parent might use a harsh parenting measure, maybe shouting, maybe beating, and whatnot. So this program came to respond to the parents' motivation and address it from the African perspective. This is why we talk about it as a homegrown program, because we base a lot of things on what the formative research showed us and the initial stages of research and the things that came out from the field about the needs that were in the community towards the parenting program. I think Dr. Siu probably can add something to that. Thank you.
No, I think maybe also just addressing the concept of masculine respectability. So this is how we are able to draw fathers or men, because this is a very important motivation for fathers. I would like to be respected, but also to promote respectable families and children. So it's kind of aspirational programming in the same, in some sense, that you draw from what people really are motivated by. And it was a result of research, not just a concept that has come or being imposed on communities. So thank you. Regarding the papers, yeah, we will send the papers to Agnes and she'll be able to circulate. Thank you.
Thank you so much for that feedback. And I think I would want to say that because of the limited time, the conversation of integrating research into measurement and learning cannot be concluded today. We still have an opportunity to continue the conversation beyond this webinar. And I would want to say that from the perspective of where I sit as well, some of the experience that has been also shared across as we interact with different partners is that one of the limitations that actually affecting them to continuously embed systematic or rigorous research within their projects is that because sometimes it is one of the less funded when you look at the program cost. So at the end of the day, it becomes a little bit quite challenging for some of the practitioners to ensure that they move beyond the start point and go to some kind of large evidence generation, which can make their evidence models, move miles in terms of credibility and be able to be adapted and used by different practitioners across the globe. So I think in terms of the reflection, it would be a very good conversation as well. Beyond the practitioners, how do we talk and influence in terms of where the funding sources is coming to ensure that as we, try to talk about the issues of how do we support partners and practitioners to ensure that their programs become more evidence-based. But, in terms of the challenge of resource, the fund base is limited, and how do we influence that to ensure that it becomes a little bit uplifted in terms of focus, even from the levels of where our donors sit. So I want to say thank you so much for listening to me. At this moment, I'm taking this back to Agnes. Over to you, Agnes. Thank you so much.
Yes, so thank you very much, our team of panelists and the moderator. I think it's very clear that the topic has generated quite a number of reflections. We have some questions that we have not been able to present here for discussion because of time, but we want to encourage that institutions can reach out to AfriChild Center and Child Health and Development Center for further engagement, but also continue connecting with us as we are planning to have a series of learning around still growing our research knowledge so that the issue of evidence generation moves from theory into practice in programs that are currently being implemented and are being planned to be implemented to prevent violence against children. And for us to able do that planning and generate a context beneficial webinar series, we need your feedback. And we have provided a link in the chat. Please do not log off before you click on that link. provide us feedback, and this shall be able to shape our next learning sessions. If you are not yet subscribed to VaCNets Virtual Hub, please visit the Hub site. We have also provided the link in the chat and subscribe. But as we end, I want to say that the learning for me sitting here at IIBC has been rich. And thank you so much, the AfriChild Center and Child Health and Development Center, Makerere University, for giving us your time and sharing these perspectives that have been an eye-opener, that integration of research in design of programs should be beyond design at baseline level and waiting for end-line measurements, to making it a systematic process at different stages of the project cycle. That has been a big learning, and I hope colleagues in attendance have been able to take that. We would like to wish you a good day,
Agnes,
wherever
can we
you
take
are.
a group photo?
Oh, thank you very much. Thank you for the reminder. Let's take a group photo before members log out. And then we give ourselves like another 2-3 minutes to fill the form, and then we shall be able to leave. Thank you. So a group photo is being taken. Please make sure that put on your cameras if you can. Okay, so we have taken some photographs. Thank you so much. And from us here, thank you once again. Kindly click on the link for evaluation in the chat, but also visit the site to subscribe and also look at some of the materials that we have already collected and put on the hub as part of what is emerging as new knowledge and evidence on preventing violence against children. Thank you and have a good day.
Thank you, everyone.
Thank you. Thank you.
Thank you,
you.
everyone. Thank you, Agnes. Thank you.